immune system, it prevents or protects the body from attacks, internal and external. Pero lang army at police natin. Next slide. So ito yung one of our component of our immune system is CD4. No? Ito yung mga cells na umaatake sa mga foreign antigen natin or viruses, fungi, bacteria. So when you have an antibody that's composed of CD4 and then something comes in, they will tell the body na may nakapasok that it would have a reaction that would attack the particular offending agent. Ang lagnat is one of your defense mechanism that is mediated by your immune system. If you have a very low immune system, especially when you're very old, have a very weak immune system, chances are you won't get fever when you have highly infectious diseases like pneumonia. Okay? So, huwag mong isipin na yung ubo mo is normal because hindi ka pa nilalagnat. Especially if you're already in your advanced age, more than 60 years old. Because your immune system actually is the one that creates the fever. Because most of our offending agent, yung nagkakause ng sakit sa atin, actually multiply in your normal body temperature. So yung natural defense mechanism ng katawan, ma-increase yung temperature para at least mabawasan or mamatay yung offending agent. So fever is one of your immune system that's mediated by it. So if you don't have fever, it means that your immune system is quite low. Yung ubo also is a defense mechanism. It just means that you need to expectorate or kailangan mo ipalabas yung kung ano mang nasa loob mo. Okay? So if you have a very low antibody or if you have a low immune system, that can be one cause that you won't see in your body. Especially if you're HIV positive, a simple cough, a simple ubo, sipon can actually be very lethal for you because your immune system cannot do anything about it. Wala ka ng lagnat, you'll just suddenly be very weak, you'll have respiratory arrest, you'll be intubated, tutubuan ka, and then you just die. Okay? Because you don't have an immune system that protects against it. Next slide po. So, an HIV infection results if you have a virus that enters the body, and then you should remember that it's a lifetime infection. Just like your hypertension. Hypertension still has no cure, but it can be managed, right? Diabetes, it still has no cure, but it can be managed. HIV also is an infectious disease that is lifetime. There's no cure, but it can be managed. Meaning you can take medicine every day, survive for as long as you're permitted in your lifetime. So it's just likened to your normal chronic diseases. However, it's for life. However, ngayon, medyo meron tayong advances. We have now documented 3 cases of HIV that were functionally cured, declared functionally cured because of certain interventions. So the chance of having a cure for HIV and AIDS is not that far off na. Maybe in 10 years' time, eventually we'll have a cure. If not, we'll have a vaccine for HIV. So we still do not have a vaccine for it. And then we don't have specific signs and symptoms for HIV infection. This is the part that is quite difficult, especially for you at yung mga government officials, because some of us would want to, tulad ng dengue, di ba? Majority of us do things when we see the effect. Di ba? Dengue, you see a lot of cases in the hospital, madali makita yun. Diarrhea, an increase in cases. However, for HIV, you have a 10-year latency period. May 10 years ka pang wala kang symptoms. So you could have 100 people that's already infected with HIV, but do not have symptoms, apparently healthy. So hindi mo makikita yan na, okay ba ako dito? Hindi mo kailangan magkaroon ng programa sa HIV kasi wala pa akong cases ng HIV. But not knowing that, already 100 or 1,000 or half of your constituents are already infected with HIV because it has a very long latency period. Latency period just means that wala kang mga symptoms during that time. So it takes around 10 years for you to develop AIDS or pwede kang mamatay because of the HIV infection. Next slide. So these are opportunistic infection. Di ba I mentioned your immune system is the one that protects you from infection, okay? However, if you don't have an immune system, ito yung mga sakit na makikita mo that would cause you to die, okay? Number one is TB. TB is our number one opportunistic infection. Kung sa Tagalog pa, ito yung mga oportunista. Pag mahinang-mahina ka na, dun pa sa papasok. So these are your opportunistic infection. TB is very common in the Philippines because we are an endemic country for TB. No? Marami tayong TB cases because marami tayong tao dito. We're highly burdened with TB. So if you have a low immune system, mas mabilis ka rin madapuan ng TB. Another is herpes zoster. Herpes zoster is just a reinfection, a reawakening of your dormant chickenpox. Okay? Because when you have chickenpox, the virus actually does not go away. It just hides in your nerve endings. No? So that's why if you have experienced herpes zoster, you can attest that it really is very itchy or very painful. No? Next is your oral hearing leukoplakia. No? It's just a fungal infection. If you let the patient open his mouth or her mouth, you would see hairy patch. Nakita niyo ba yung bread na nagkaroon ng molds? Di ba medyo mabuhok siya? Puti. That's the same thing that you would see in oral hairy leukoplakia. No? So if you scrape that off, it would bleed. Another one is oral candidiasis. It's still a fungal infection. It's just molds. Parang molds lang siya sa mga bread nyo. If you scrape off the white part, it would also bleed. Pleuritic papilla eruptions is a dermal reaction na medyo makakaroon ka ng rashes all over your body. Then the last part is an X-ray of your pneumocystis jirovecii pneumonia. It's just pneumonia that if you're normal, hindi siya magkakaroon ng infection. You won't get sick. But if you have a very low immune system, you would actually die of this one. Okay, it's quite mataas yung mortality rate natin for this. Then you have cryptococcal meningitis. You would have infectious agent in your brain. So we are seeing patient actually that would have this. So okay in a week, then after a week, wala na, nakahiga na, would have seizures, would have very high fever, would have blindness, and then they will eventually die. Okay, because it's central nervous it's a central nervous infection. Then cytomegalovirus retinitis, this is quite sad because once you have this, it would lead to blindness. No? So mabubulag ka talaga. We had one case here in Cebu. He actually was a doctor to the barrios. No? He was involved in the program. However, medyo meron siya high-risk behavior. Nagkaroon ng HIV. He wasn't actually diagnosed, but he had CMV. So doon namin nakita na possible siyang HIV. We tested him. He was positive. So we treated, we gave him medicine for HIV. Then we tried to treat the CMV retinitis. We saved one eye, but we could not save the other. So one eye is already blind. Okay, at 25 years old, bulag na yung isang mata niya. And then lastly is Mycobacterium avium complex. It's just like your TB. It affects your respiratory system and can actually become disseminated. So these are just a few of your opportunistic infection. Di ba sabi ko HIV does not have symptoms? Wala ka makikitang sintomas. If you have already these particular diseases, you're no longer HIV infected. You now have moved to the terminal phase of HIV, which is AIDS. Okay? So HIV and AIDS actually are related, but they're not the same. You can be HIV infected but not have AIDS, but if you have AIDS, you automatically have HIV infection. Okay? So our goal in the program is to have treatment for you so that you remain HIV infected and you will not go towards AIDS or the acquired immune deficiency syndrome. Next slide. So ito yung AIDS, no? The difference between AIDS and HIV. So AIDS is the first letter A stands for acquired, meaning you were not born with it. Because we have actually people that are born without an immune system. Have you heard of bubble boy? Yung tao or yung bata na kailangan nasa loob ng isang bubble or a room that is sealed off because they cannot stand foreign interaction, no? So they will get sick and then they will die. So that's an inborn immune deficiency. But for this one, it's acquired, meaning you got it after you were born. Then immune and deficiency, that's the effect. The virus destroys your immune system, making it quite very low or even zero or negative. No? And then syndrome, because if you look at the case kanina, it's actually a collection of diseases that are not related to each other. No? Meron kang dermal infection, meron kang ubo, meron kang sa problema sa mata, meron kang problema sa utak. So it's a collection of signs and symptoms. Same as your flu, no? Flu is a syndrome. It's a collection of symptoms. You would have runny nose, you would have fever. Some of us would manifest with abdominal upset, no? Meron mga tao nagkaroon ng flu can actually have diarrhea diseases. So AIDS is different from HIV. So you will have HIV infection before you would have AIDS. But because of treatment now, it does not mean that if you're HIV infected, automatic ka na magkakaroon ng AIDS. No, because we now have medicine for that. To protect the body and maintain the level of your immune system and maintain the low level of your HIV or your human immune deficiency virus. Next slide. So a person with HIV does not necessarily have AIDS. Okay, klaro yan ha. So pag may sinabing HIV positive, hindi yan automatically AIDS patient. Okay? And if you're AIDS patient, of course, nagkaroon siya ng HIV infection. So AIDS is a condition of a person infected with HIV when the immune system already is very weak or destroyed and can no longer fight off common opportunistic infection. So your flu, your colds actually is an opportunistic infection because you get it when you are very sick. So that's why for our patients who are HIV infected, we want them to be stress-free. No? Lalo na kayo, mga government officials natin, you need to have a very low stress life. Why? Because stress actually destroys your immune system. Especially lack of sleep. Napansin nyo yan? If you 3 days or 1 week straight kayong walang tulog or 2 or 3 hours lang yung sleep nyo, chances are you would get ubo or sipon or trangkaso. Because it actually destroys your body's immune system. Because sleep actually is the time, or rest is the time for your body to build up your damaged parts. So if you have no or close to little sleep, sisira din yung immune system mo. So however, for HIV, the stress just adds to the decrease or the destruction of your immune system. Next slide. So AIDS can lead to unnecessary death if not treated. So unnecessary because we now have treatment for HIV. Okay? And HIV treatment actually is for free. For life. Okay? So wala na talagang reason na hindi ka mag-access ng treatment. Unlike before, that they were taking 12 pills per day, they have to take it 3 times a day for life. Now we're only taking 1 pill per day. Okay? So just taking, this is parang uminom ng multivitamins. You need to take the same medicine at the same time every day so that you would maintain the level of your immune system at healthy and keep the level of the virus at a very low count, even undetectable levels. It's quite possible right now with our medicine. So how is HIV transmitted? So I mentioned of the 4, di ba? Yung sexual contact, blood transfusion, yung injecting drug users, and your mother-child transmission. Next slide. So actually we have 3 only because I mentioned na eliminate na natin yung blood transfusion. So next slide. So unprotected penetrative sex, no? So kita niyo yung picture, kailangan mayroong penetration. So if it's just contact-contact, medyo low risk pa yan. But once you penetrate either the mouth, the vagina, or the oral or the anal orifice, that already is a high risk for HIV. Okay? And it should be kailangan magkaroon ka ng protection. That's why one of the qualifiers is penetrative unprotected sex. No? Walang condoms and whatever. So it can be male to male, male to female, male to female. Okay? Next, mother to child. The mother to child actually can have 2 ways. Either during childbirth, si mother mataas yung viral load niya, nung pinutol yung pusod, lumabas yung dugo ni nanay, nahalo sa dugo ni baby, then pwede mahawa si baby. Another route is your breastfeeding because the breast milk is one of the fluids that have a very high viral load content. So pag ininom niya ni baby, mahawa si baby because of the virus in the breast milk. However, if the mother is taking the medicine, the virus in the breast milk actually can go down and even not infect the baby. So our goal is to test the mother so we can give medicine. Next is injecting drug users, no? And your hazards of work, yung mga nurses, medtechs natin, and doctors. Next. So we have 4 principles. Pag-click na lang po. So, click pa, one more. Click pa. Next. Next. Okay. So you have ESSE principle. Ito yung sagot bakit if you have two persons exposed to HIV, not necessarily that when they have sex with the same persons infected with HIV, it does not mean that automatically yung dalawa magkakaroon ng magiging HIV infected. Because of the principle of ESSE. You need to have a sufficient amount and you need to have the virus survive for it to become infective. No? So that's why if kinain mo yung fluid na mamamatay yung virus because of the acidity of your stomach. If you have a virus, if nagkaroon ka ng sexual contact, nilabasan sa labas ng katawan mo, nasa skin lang, hindi ka magkakaroon ng HIV if you don't have wounds because yung virus walang mapapasukan. Okay, mamamatay lang siya done because of the dryness of your skin. Okay, so you need to have these four principles. If dalawa lang yung present, mamamatay yung virus, the virus will not be infective. Okay, so you need to fulfill the four criteria for you to have HIV infection. Next slide. And you need to have four conditions also for the virus to survive. Tama. T is for temperature, A is for air, M is for moisture, and A is for acidity. So these four factors can actually cause the death of the virus or promote its growth. If it's very normal temperature, mataas yung survival ng virus. If hindi siya mahangin, meaning hindi madaling ma-dry off yung area, nagsusurvive yung virus. If yung moisture is enough, hindi siya ganun ka-drying, the virus can survive for a long time. And if the acidity is quite basic or parang tubig lang yung acidity niya, hindi mamamatay yung virus. So actually the virus is very easy to die or to kill. Alcohol can actually kill the virus. So if when you are doing the manicure, pedicure, di ba yun yung takot natin na baka mahawaan tayo kasi hindi linis. But just soaking it in hot water for around 5 minutes or using alcohol to at least clean the parts off, you can actually kill the virus off. Okay, so it's just that easy. That's also one reason that if you are sharing a pool with a person that's positive for HIV, tapos nasugatan siya, you cannot get infected because of the chlorine of the pool. So madaling mamatay talaga yung virus natin. Next slide. So these are our four body fluids that you can get infection for HIV. One is blood, semen, breast milk, and vaginal fluid. So these are the only fluids that if you get into contact with, you would have a high chance of getting infected. Saliva is not there, urine is not there, sweat is not there. So ito yung mga areas na, mga fluids na hindi ka pwedeng mahawaan. But for these four fluids, mataas yung viral load niyan. So, or yung virus, yung dami ng virus will be enough to cause an infection. Next slide. So, BSBF, ang sinasabi namin is always be safe and be vigilant. No? So, kailangan mo lang malaman kung ano yung mga fluids for you to at least get protected if you're exposed to those particular fluids. Tears, saliva, sweat do not cause infection. Next. So, it's not transmitted through swimming pool. Click pa po, sir. Click pa. Toilet bowl sharing. Kissing, sharing of utensils, and coughing. Okay? So these do not cause infection because wala yung blood, wala yung vaginal fluid, wala yung semen, tsaka wala yung breast milk. Okay? So these do not transmit HIV. So if you have someone that is positive for HIV, you can actually do all these things. You can kiss him or kiss her, you can hug him or hug her, you can have the same food or share a bowl of soup with him or with her because saliva does not cause you to have HIV infection. Next. So how do we prevent HIV? No? So we have A, B, C, D, E. So yung sinasabi natin na condom mo lang talaga yung programa ng gobyerno, it's not true. Because the first letter stands for, pakiclick po, A is abstinence. No? So because the majority of our cases are transmitted by sexual contact, if we don't have sex, we don't get infected. Kaya ba natin itong gawin? Mga lalaki, kaya yung gawin, no sex? For 3 days? Kaya? Kaya. This is the safest, however, it's the most difficult, especially if you have partners. Okay? So abstinence is very difficult to do, but it's 100% safe. Ito yung tiniteach ng church. No? You don't have sex outside marriage, you don't have sex at all. However, it's very difficult. That's why we have letter B. Letter B stands for be mutually faithful. So pag may asawa ka, asawa lang din yung yung kakaroon ka ng playtime. Okay? Wala na yung sideline, side 1, side 2, side 3, side 4. So wala na yung networking mo. So kung sino yung isa, siya na talaga. And it should be mutual. Hindi pwedeng si Mrs. yung faithful. Kailangan si Mr. din. Kasi kung ano yung sakit na kuha ni Mr., pwedeng matransmit kay Mrs. Or kung ano mo kuha ang sakit ni Mrs., pwedeng matransmit kay Mr. Okay? So it should be both ways. And then if hindi talaga kaya maging faithful, you have the third letter. That's your correct and consistent condom use. Okay, so yung condom natin is just a third option. Okay? So, ano yung mga qualifier? It should be correct. Alam niyo, sino nakagamit ng condom dito? Ako lang? Okay? Yung condom, hindi pwedeng gamitan ng mineral oil. Okay? Hindi pwedeng gamitan ng petroleum jelly. Kasi it can actually destroy the condom. So, napunit siya hindi dahil malaki o maliit yung condom. Napunit siya kasi mali yung lubricant mo. Okay? It should only be used with water-based lubricant. Another one, it should be consistent, no? Hindi pwedeng tingnan mo yung partner, or sino ba yung playmate mo na parang mukhang malinis to, hindi ako magkakondom. Or ito mukhang marami itong experience, kondom ako. No, because as I mentioned, HIV does not have a symptom. He or she can look perfectly well, be very healthy, but then again infected with HIV. So pag hindi ka na-condom, pwede ka matamaan. So it should be consistent and it should be correct. And then letter D is do not do drugs or abuse alcohol. Bakit? Because when you're intoxicated, you can actually do something that you might regret or you don't usually do. No? So that's why we do not encourage that because it leads to high-risk behavior. And then do not share infected needles. And last letter is E. This is where you guys would be very helpful in the local government, in the grassroots, because you actually are very influential in teaching your constituents on how to protect themselves towards HIV infection. Or if they already are HIV infected, encourage them to seek treatment. Okay, so again, ABCDE, abstinence, be mutually faithful, correct consistent condom use, do not abuse alcohol or share needles, and education or early diagnosis. Okay? And then, HIV testing is the only way for you to know if you're HIV positive. No? Hindi mo pwedeng tingnan na itong mukhang maraming experience to, parang maruming tao to, HIV positive na to. No. So the only way for you to know if you're HIV positive is for you to get tested. Okay? HIV testing is for free. It is voluntary. No one can force you to get tested, and it's confidential. The results are only released to the person that's being tested, even if the result is negative. Okay? So if nagpa-test ako, tapos negative yung result, nagtanong yung kaibigan ko, under the law, that person testing me does not have the right to divulge my test even if it's negative. Okay? So that's how confidential the case is. Next. So you need to know the concept of window period. Yung window period kasi, ito yung time it's the time or the amount of time that the body is trying to build an antibody that can become positive for testing. So if wala ka pang antibodies na nagawa, your test can actually result to negative within the 3-month period. So that's why we encourage if you're engaging in sexual practice, sexual behavior, high-risk behavior, yung na-mention natin kanina, you should get tested at least 4 times in a year or every 3 months. Okay? For you to have the window period, matetest ka outside the window period. Next. Next. So ito yung sabi ko, HIV infection is the first 2. AIDS is your last 3. No? So, you can get AIDS if you don't get treated. Kasama na yung kabahang doon. Because that's the eventual end of your AIDS. No one gets off AIDS alive. Or if you become if you got rescued at AIDS, you actually have a lot of disabilities that comes with it. Okay? Next. Next. So around 2 to 15 years or around 10 years that you would develop AIDS. Okay? So this is our service delivery network. It would be very helpful if you ask your regional office or your provincial or city health offices how HIV is being referred in your area. In Cebu, we have health centers that have testing and treatment for HIV. However, if these centers can no longer manage the patient, they are referred to higher centers or to our hospitals. And ultimately, our highest hospital that's treating HIV is Vicente Soto Memorial Medical Center. So there is actually a network from private practitioners, health centers, primary, secondary, and tertiary hospitals, and even private clinics or private labs actually are part of our networking. So if they have patients for testing and for treatment, they refer it to the nearest center that they have. And we have a service delivery network where we meet every quarter for us to discuss the problem of each particular leg of our network. And I think it's quite operational also in your region. Because under the DOH, all centers of health development should have at least a service delivery network for referral. Next. So ito yung mga number of hospitals natin that you can actually access services and treatment. It's quite busy. Anyway, my slides I'll be leaving my slides. I hope that they can give you a complete list. I also have a list of the hospitals in region in all the regions of the Philippines, so that would be helpful for you if you need to refer someone or you want to get tested for HIV. Next. So in Cebu, these are our areas. We have a lot of treatment in Cebu province because a lot of our cases are concentrated in Cebu. Next. So, things to remember in summary, AIDS is incurable and is often, if not all the time, fatal. Infection is lifelong. A person with HIV is infectious for life unless he gets treatment with ART and can actually have undetectable viral load. Pag undetectable ka na, you actually become untransmittable. No? So I have HIV, I'm taking medicine, I can have sex without protection and not transmit the infection to my partner. And if I'm a pregnant mother, I'm taking the medicine, I cannot transmit the infection to my baby because the viral load is very low. So mababa na yung amount was no longer sufficient for transmission. No? So that's a very good news for the program. And as I mentioned, anyone can get HIV infection. You cannot tell who is infected. The only way for you to know your status is for testing. And of course, as I mentioned in my opening, this is a man-made health issue that you can do something about. Because it's a behavioral issue, you can actually do something to prevent it. So HIV is 100% preventable. Okay? Even for babies who are yet to be born. Because pwede ma-prevent ni mother yung transmission. Next slide. So, I hope that you learned something. Do we still have time for questions? If you want to ask a question. Again, thank you for inviting me and share the program with you. I hope that you would be able to be more active in HIV prevention because the Philippines needs a lot of partners right now. Because if you don't do anything, it will be your children, your grandchildren, their grandchildren will be infected with HIV. Okay, so with that, again, thank you for inviting me and I have a safe trip going home and enjoy Cebu City while you're here.
We would like to appreciate you, Dr. Van Philip Baton. Sir, please remain right there on stage. And we'd like to request the recognition is given to Dr. Van Philip Baton for giving his invaluable lecture and support that we have tackled the HIV awareness and prevention program.